I don't know if you want me to talk about the birth story.
You had a hard birth too.
Yeah, hard birth.
Yeah.
They asked me to go do the ultrasound, and they said there's 0 amniotic fluid left. So they say C-section right away. So at that point, like, I just cried because I wasn't ready. I wanted to do natural birth, but everything wasn't the way I planned it.
The contractions were terrible, just absolutely terrible. So all of this drug-free, almost 20 hours by this point. At the very end, when I was like, okay, baby's coming out, I need to push now, the nurse came in and she did a pelvic exam and she was like, something's wrong. And we're like freaking out. And they bring in an ultrasound machine. She's breech. At that point, they were like, okay, now we have to do a C-section. So after 20 hours of just like pushing and like experiencing like this painful labor, I know I had to get pumped with every single drug I was trying to avoid anyway. And
those are my friends, Anissa and Linda. In a lot of ways, their stories are emblematic of a growing trend in America. They didn't become moms until their late 30s and early 40s. And they both had C-sections. This is also my story. I'm 42 and having a second daughter and a second cesarean section. Look at her face, Jetty. You see her face?
She's kind of like this. Oh my God, she totally has her mouth. She's a little skinny.
She's skinny?
She's a little skinny.
Even though we're so close, every time I come, I just have so much anxiety because Dr. Sticking has been with me for so long with three miscarriages and your jet.
Let me give you a hand up, baby.
Thank you. Thank you.
For the C-section, when we schedule them, and preferably you're not in labor, they'll put you and the baby on the monitor. They're then going to either sit you up or lay you down, depending upon the anesthesiologist's choice. And what they will do is generally they put in a spinal. Spinal is the most common form of anesthesia that's used. It's going to feel like a prick in your back and a lot of pressure. It is going to be uncomfortable.
I'll feel it. I remember that.
And what's most important is that you try to stay as still as possible.
Can't believe we're doing this again.
I know.
I'm too old for this.
No, you're not.
In just a decade, the rate of C-sections shot up over 50%. In the U.S. today, 1/3 of all deliveries are done by this surgery. That's well over what the World Health Organization says is a medically necessary rate. Medically necessary. That's key, because while there are more women having children into their 40s and more women with health conditions that make pregnancy dangerous, there are some C-sections that are happening for no medical reason at all. Some are even scheduled ahead of time. I had a C-section for my first. Her cord was wrapped around her neck, so I was told I had to have a C-section for that reason. But it was kind of nice to know exactly when I was going to be giving birth. I had a date, I had a time. I wasn't in that kind of limbo phase.
I mean, especially now in the world that we live in. We like to plan. The majority of women are working women, or they have other children, or they have a busy life. Any of the nurses that are at the station can actually...
Dr. Allison Brooks runs the Women's Health Institute at Hoag Hospital in Newport Beach, California.
This is a typical labor room, which is pretty phenomenal.
Just a few years ago, this hospital had a C-section rate of 38%.
We could justify some of the convenience deliveries. There was no external pressure asking why. Why do we have a higher cesarean section rate?
Do you get the sense that more affluent women are opting for C-sections?
Education and income and age of the woman who's pregnant definitely play a role in their preferences for a scheduled or a planned delivery.
Maternal and newborn care top the list for hospital expenditures in the U.S., and C-sections are on average 50% more expensive than vaginal births. They cost employers and taxpayers billions every year. So when it comes to cutting our nation's healthcare spending, the elective C-section has come under increased scrutiny.
When I served as Secretary of Health and Human Services, we were trying to encourage hospitals to really eliminate elective C-sections when it's done for the convenience of the patient or the doctor, no medical emergency. Elective C-sections, particularly before 39 weeks, can be enormously problematic. If you think about labor and delivery, it's often not a very routine process. Women are given a due date, and it could be, within 2 weeks that it's off. C-section reduces that uncertainty dramatically. From a provider and hospital point of view, that's a pretty efficient way to deliver babies.
The physicians can exert influence and make recommendations that make their lives a little bit easier. And their patients trust them implicitly. Some of what we're doing is not medically indicated, it's convenience or it's preference, and that's not the best way to practice medicine. Hospitals are being narrowed out of certain networks based on their overall C-section rate.
That nearly happened to Hoag Hospital. Then it started exposing each of its doctors' C-section rates. The results?
It's a cultural change. It's a big cultural change. And the first thing that happened is that the physician said it was all wrong. There was a little bit of that incredulousness of, how could you question or even compare me to someone else? There was some frustration by the physicians that had the less attractive numbers.
It's working. Since 2012, Hoag's C-section rate has dropped 4%.
So up here it said Doctor of the Month. We had a VBAC king at one point, so vaginal birth after C-section. Someone who really counseled his patients of the safety of having a vaginal birth after a prior cesarean section and helped us really improve our rates. He was like the leading champion.
So you actually acknowledge doctors for reducing their C-sections?
Yeah, like allowing their labor to go on a little bit longer or for them to push a little bit longer and not being too quick to come in and say your body's not doing what it should or it's time for us to intervene.
So do you think physicians and hospitals are incentivized to perform cesareans over vaginal births because it's more lucrative?
The majority of the contracts that we have here, we're reimbursed the same whether it's a cesarean delivery or a vaginal delivery, to try to remove that tension between what's the right thing to do and what entrepreneurialism might come in. I think the physicians realized that the women were empowered. The days of being a passive patient are gone.
What's the most advisable way that you would suggest a woman try to give birth?
To wait for the spontaneous onset of labor, let it be a big surprise.
I was one of those women who decided to schedule a C-section out of convenience. So going into labor wasn't in my plans, but that's where I ended up.
My water broke at 4 a.m. on June 6th, my actual due date. Not to be TMI, but it was a pretty big gusher at 4 in the morning, so I came straight to the hospital. I actually scheduled my C-section for Wednesday, 2 days from now, which is unusual because I usually schedule C-sections before the due date or on the due date, and I've been so crazy that I thought, let's just try to do it 2 days after. But this baby has a mind of her own and wants to come today. So having contractions about every 10 minutes and they don't feel good. So it's going to be a long day. And hopefully my baby's okay.
Hey, this is Dr. Ching. He's going to be administering my anesthesia. It's kind of crazy. I'm in the ER and I'm going to be awake for this surgery but not feel anything. It was very, very bizarre 3 years ago. Over and out.
Just hold on. It'll take a minute. Okay.
She's so cute.
So it's been a couple months since I had the baby, and she is doing great. But I didn't record a video because I actually had a very difficult recovery from this second C-section. A couple weeks after getting home, I developed an infection. My husband, who's a doctor, suspects that I may have gotten it in the hospital, and I wasn't really aware of how rampant hospital infections are. I mean, I was shocked when I started Googling information about hospital infections. I was truly shocked. So this recovery was brutal. It took so much longer than my first C-section, and I have to say that I spent so much time talking to people about the benefits of a vaginal birth versus a C-section for this series, and yet I still went ahead and scheduled a C-section because I had had a good experience the first time and it was convenient for me. And in all honesty, I regret it. I went through a lot. It was really, really difficult, and I'm grateful that I'm okay now and my baby's okay, but it was not easy.